All right, it's still a continuation of Module 11. So now we're in Chapter 37. So mental health disorders. So again, in terms of mental health disorders, it affect physical, emotional, social, spiritual, and intellectual life of the individual. It may result from combined biological, psychological, and environmental factors. Depends on the client's what's going through with the client and client's condition. It actually impact the coping ability, the thinking of the individual, the mood, and the behavior. Right. So there might be some stigma in culture with regards to mental health disorders. So when there is a stigma, it might lead to discrimination and isolation, so the client might start to question him or herself, and they feel being discriminated and not being part of the society, right? So that's why they isolate themselves. Also, the cultural beliefs influence perception and treatment. So it depends on the client's cultural background if they believe that it should be taken care of by a professional doctor or not, or maybe they think that it's just like it's all in the mind and you just need to like move forward. That depends on the cultural background as well, right? Also, marginalized populations face increased risk, right? So there might be a lot of some scenarios nowadays, like it affects our mental health. Sometimes, again, always remember that mental health is also same with physical health, right? So again, we have what we call anxiety and trauma disorders. So when we say anxiety and trauma, this includes anxiety, panic disorders, your phobia, your post-traumatic syndrome disorder. There might be symptoms that includes clients are feeling afraid or fear. They feel avoided or they have this avoidance feeling. They also experience hyperarousal. So again, those symptoms may differ from different clients and different conditions and scenarios, right? So mostly this disorder can be treated with therapy and medication. Okay? This can be treated with therapy and medication. How about mood disorders? So includes bipolar disorder and major depression. It's characterized by mood extremes or prolonged sadness. Depends. It could be like to the highest and to the lowest feels. It requires a long-term treatment or medication, and of course regular monitoring of the individual. While the psychotic and personality disorders, these some examples are that it's schizophrenia. It affects the perception and the functioning of the person. The personality disorder, this actually involves a rigid behavior patterns. They feel like so extreme. Sometimes they feel like they are not themselves, right? So it usually focuses on safety and structured care for these individuals, because sometimes they might gonna think that they are the queen of the world, right? Something like that. So those are some example of psychotic and personality disorders, like the schizophrenia. And we also have a substance use and suicide risk. Substance misuse affects mental and physical health. So that's alcoholism or anything that is substance abuse, right? Suicide risk may increase in mental illness. They might gonna end their life because they're having a hard time dealing with the mental disorder that they. So make sure that you always manage when the client is talking about death or feeling like dying, etc. Also, early interventions to save their lives, because if you notice that the client might be verbalizing that she wishes she is not here in the world, then that means that might be a sign of suicide, right? So you need to call immediately for help and making sure that you report that immediately so that the client won't be left alone. When we support them, again, always follow what's in the care plan and always a team approach so that we will be all in the same and united care. Make sure we always maintain their safety and maintaining their dignity despite the mental disorder that they are having. Make sure also we need to give or provide a compassionate care, respectful communication, right? So it's very important that even if they are going through mental disorder, we need to be compassionate and we need to be respectful to our clients. Again, it's same book, Mental Health Disorders in Healthcare Assistance Textbook. It's in chapter 37. All right, so see you in the next chapter.